Hello, everyone. Welcome to this webinar on balancing public health and privacy. My name is Corey Shapiro. I am a board member of JCPA and vice chair of JCPA's Public Policy Advisory Committee. I am very delighted to moderate this very important and highly timely discussion. JCPA, the Jewish Council for Public Affairs, is the network hub of 125 Jewish community relations councils and 17 national organizations. We work with our network to develop public policy and advocate together with our partners in other communities. This pandemic has raised all sorts of complicated new issues, new wrinkles on old issues, and I'm guessing unless you happen to be an epidemiologist, public health expert, or civil liberties expert, you've probably not heard the term contact tracing as recently as even a month ago or 2 months ago. And yet here we are today with over hundreds of people talking about contact tracing, and you probably are somewhat familiar with the concept. There's widespread consensus among public health officials that testing, tracing, and isolation are absolutely critical in containing the spread of the novel coronavirus. In fact, the concept, though, of contact tracing is not really new to those in the public health fields. It's been used for decades, perhaps even centuries, to isolate all the contacts in a person's chain to figure out who that sick person may have made contact with. It's been one of the most effective public health measures at our disposal over time, but never before have we had the capability to use technology to help assist in that contact tracing measures. Early on in Israel and South Korea, those countries used contact tracing via cell phone data to identify locations and contacts of infected individuals. Today, we have major software technology companies developing state-of-the-art applications so we can trace exact times and locations, allowing us to know who might have been exposed. Sounds great, but as those of us who work in the civil liberties area know, the solution to one set of problems frequently leads to privacy concerns. And so who's going to possess that data? How might the government use that data to track us? And how might commercial and government and other interests use those in harmful ways for our privacy? We at the JCPA want to make sure that those of you here in our network understand the implications of this important emerging policy issue. And to do that, we've brought together 3 of the top experts in the field. We have with us today Neema Singh Guliani, who's a senior legislative counsel with the American Civil Liberties Union in their Washington legislative office. She focuses on surveillance, privacy, and national security issues. Prior to joining the ACLU, she worked in the Chief of Staff's office at the Department of Homeland Security, concentrating on national security and civil rights issues. She's a graduate of Brown University and has a JD from Harvard Law School. Jameel Jaffer currently serves as the founder and executive director of the National Security Institute and as an assistant professor of law at the George Mason University, at the Antonin Scalia Law School at George Mason University, where he teaches classes on counterterrorism, intelligence, surveillance, cybersecurity, and other national security matters, as well as courses with Supreme Court Justice Neil Gorsuch in Padua, Italy. Sounds like a great place to be right now. Unfortunately, we can't all be there. Jamil is also affiliated with Stanford University Center of International Security and Cooperation and served as a visiting fellow at the Hoover Institute from 2016 to 2019. Professor Susan Landau is the Britt Professor in Cybersecurity and Policy at Tufts University and a visiting professor in the Department of Computer Science at University College in London. Professor Landau works at the intersection of cybersecurity, national security law, and policy. She's published 3 books, the most recent of which is titled Listening in Cybersecurity in an Insecure Age, which came about because of her expert testimony in the Apple FBI case. Professor Landau has frequently briefed US and European policymakers on encryption, surveillance, and cybersecurity issues. We are in for a treat and a lot of expertise here. We're going to start off with Professor Landau, and then Neema will speak, and then Jamil will speak, and then we'll open it back up for questions after that. So please put your questions in the chat, and we will be able to ask those, or I think there's actually there may be a questions panel as well, And please put those in there, and we'll try to get to as many as possible at the end of all 3 presentations. So thank you very much, and look forward to hearing some of your questions. Thank you again.
Thank you. So when I think about public health and privacy, I don't think of them as necessarily in opposition. In order to do contact tracing, in order for contact tracing to work well, you have to have the trust of the people from whom you're contact tracing. This goes back to whether you're looking at TB patients or sexually transmitted diseases, including HIV/AIDS, which is of course transmitted both sexually and through blood and fluids. In all of those, the people contact tracing, the old-fashioned system, which is still the system we rely on today because it works, that system requires trust. People won't listen to you about what they should do, whether they should quarantine themselves or isolate themselves, and they won't share information with you about where they were and who they were with if they don't trust the contact tracer. So trust is absolutely essential, and privacy and maintaining the person's privacy is therefore an important part of it. When COVID became an issue in the United States, but also in other parts of the world, people turned to the idea of using technical tools to help locate people's contacts. So in China, that didn't happen because essentially everybody in Wuhan got locked into their apartments with lots of patrols to make sure that happened. But in other parts of the world, for example, in South Korea, the South Koreans looked at a whole bunch of information. They were less interested in the phone information than they were in the credit card information. And they didn't look at data on the phone about who you had contacted, but they did look at GPS data. So many of you know that when you move about, your phone is constantly, if you have a smartphone, it's constantly in communication, not just with cell towers so that you can get phone calls, but also with the GPS satellite. That's how you get mapping directions that tell you when to turn left, when to turn right, and it's extremely useful. It's less useful in COVID contact tracing because while it says where somebody is outside, it doesn't say where they are inside. Contact tracing, with COVID, the spread of the disease occurs almost all the time in enclosed places when people are spending significant amounts of time, that is more than a few seconds, but 15 minutes or more in the same space, about 6 feet or less, well, less than 6 feet apart. And GPS data doesn't work inside. The satellite signal doesn't penetrate inside. Other signals do penetrate inside. So whenever you log on to a computer, whenever your phone is using the Wi-Fi signal, the Wi-Fi, you're in proximity to that Wi-Fi router. And that information can be used to say when are people close. But as you all know, the Wi-Fi router might serve a very large room or an apartment with people in separate rooms, or an office with people in separate offices. And so Wi-Fi routing information isn't sufficient. So Apple and Google a couple of months ago turned to the idea of using Bluetooth, which is a signal that looks at that works on a shorter distance. You all use Bluetooth when you're using a wireless mouse or a wireless keyboard. Google and Apple set up an infrastructure to enable to tell when two people are within a Bluetooth energy signal. That sounds great because Bluetooth works less than Wi-Fi. It works inside and it works at a shorter distance. That sounds great, but I didn't tell it to you exactly accurately because Bluetooth signals go through walls. So if you're living in an apartment building, a Bluetooth signal on your device may be picked up by the person in the next apartment. And you guys are not sharing the same airspace. There's no way, unless you meet in the hallway or in the elevator, that you can one person can actually infect the other. So Bluetooth is not a perfect solution. But let me tell you a little bit more about the Apple-Google infrastructure that they're building, because they attempted to do something that is very privacy protective. What they did is they set up an infrastructure so that public health authorities could provide contact tracing apps. And that infrastructure is dependent on Bluetooth Low Energy. It works in a way that doesn't drain the battery of your iPhone. And it has the identifier you use change every short amount of period. It could be it could be as much as 15 minutes. It's not more than that. So if, for example, Corey and I had both downloaded the healthcare app from, let's say, the state of Maryland onto our phones, then I would be sending out a signal fairly often that Corey's phone would pick up. Every 15 minutes, my signal would change. At one point it might be iced tea 15, and the next time it might 15 minutes later it might be reading glasses 17. You can tell what's on my desk. The third time after that it might be cell phone 23. But the point is, it's all different. Corey's might be sending out completely different signals. It might be sending out HS572, and then 15 minutes later it might be sending out T2837Y. But the signals are all different. My phone collects Corey's signals. Corey's phone collects my signals. Suppose a couple of days after Corey and I have exchanged, our phones have exchanged that contact information, I'm diagnosed positively with COVID. Then the public health authority will send me a certificate from my phone that says I have been diagnosed positively for COVID. My phone then notifies a central authority that all of the identifiers I used, ICE-T17 and so on, all of those within that 2-week period where I was contagious, it marks those as that person was contagious, that identifier was contagious. Corey's phone once a day checks that central database, and Corey's phone says, ICE-T17, I was near ICE-T17 in that period. I better go and self-isolate now, and not self-isolate, but quarantine till that 14-day period is passed. Notice that what the central database has is simply the identifiers of the person who has been diagnosed as COVID positive. It doesn't carry the identifiers of Corey's device, so it doesn't know who I have been around. Anybody who's trying to track me will get different identifiers every 15 minutes. It'll find iced tea, it'll find reading glasses, but it won't be able to tie together reading glasses and iced tea and so on. Google and Apple have said that they will accept as apps for this, using this kind of information that do not collect location information, that only rely on this contact tracing of the sort that I've just described, and that at least in phase 1 are only done by public health authorities. The reasons for all these different pieces are to preserve privacy, also to preserve security, to make things sure the system is secure. You don't want all sorts of dogs running around with cell phones. That may sound ridiculous, but there was an art project in Germany not so long ago that had many cell phones on a wheelbarrow or a dog wheeled around, and it made it look as if it was a traffic jam in that particular part. You don't want somebody to spam the system and pretend to be diagnosed with COVID and therefore alert lots of people that they have to quarantine themselves when it turns out not to be true. So they've designed their system with privacy in mind. Now, there's been objections by some of the public health authorities that the information you have been exposed is not sufficient. Apple and Google have changed the name of what they're doing. They had originally called it contact tracing. It's not really contact tracing. It's really exposure notification. And of course, exposure notification, per what I said earlier, it could be that you're getting a false positive because you're getting a signal from somebody in the next apartment who you haven't been exposed to, but the Bluetooth signal alerts that you have. You can also get false negatives. That is, we know that there are a lot of asymptomatic carriers. That is, somewhere between 18%, maybe as high as 50%, maybe even higher, of people who have COVID never show symptoms. Those people will never get an authorization from the public health authority to say that everybody around them in that 14-day period should be warned that they've been exposed. And so if you've been exposed by an asymptomatic carrier, you won't know that. And that may convince you that you're safer to go around and be with other people, like your grandmother, like your grandfather, like somebody in the hospital, safer than you actually are, in fact. So the best way to be using these apps is to be using them with a human contact tracer. They have not yet been designed for the workflow that human contact tracers use. With that, I'll stop, and I believe Neema is up next.
Now, thank you so much, Professor Landau. Our next speaker is Neema Guliani, and I'll let her take it from here.
Great overview of the technology itself, and really some of the questions that are still circulating about whether it will work and be effective for the purpose in which it's been put out there. I want to talk a little bit about putting aside some of those technological questions. What are the policy considerations we should have before we roll out something like this? My personal view is that if we roll out, whether you call it a contact tracing app or exposure notification system, if we roll out the ones that have been contemplated without thinking through the privacy and policy considerations that have to be in place, where we could end up is in a place where we actually harm existing public health efforts because we've created a system that people don't have faith in. It deteriorates overall public trust in the system, and it potentially leaves out communities that are most at risk for contracting and developing sort of complications from COVID-19. So I want to talk to you a little bit about some of those, what I think of as the 6 policy pillars that have to be in place, even if we go down this road of considering this technology. The first is questions of effectiveness. There are still questions about how many false positives and false negatives you could have from the type of Bluetooth contact tracing that Susan described. And we also don't know, one, what are these false positives and negatives? What are the rates going to be? Second, we don't know, outside of just the technological aspects, what will be the impact on personal behavior. So for example, if an individual gets a notification, will they actually take the proper steps to, let's say, get tested or quarantine themselves? When public health professionals talk about traditional contact tracings, one of the things they emphasize is that part of the reason the process is so important is not just the notification aspect, but the part of the process where you talk to an individual, you connect them with health resources, you gain their trust, and you encourage them to take appropriate follow-up care. So we don't know how this type of technological tool will interact with that system, and indeed whether it will be effective at all in actually prompting people to take follow-up health action that's necessary. So before we go forward with a contact tracing tool, at the outset, we ought to have clear benchmarks for how to measure effectiveness to ensure that the tool actually works, but also that we're not wasting unnecessary health resources that could be put to use in other places. So for example, in Utah, they deployed a contact tracing tool. It cost several $1 million to develop, and I believe the last statistics I saw was only about 40,000 people were using it. That's money that likely would have been better spent using alternative public health and contact tracing measures. And so, we want to have sort of the clear benchmarks at the outset. So if it turns out the tool is not effective and it's not working, we know, and we can sort of, switch our efforts to other means. The second question that I think we really have to address is questions about equity. Even if these tools work, there's going to be large numbers of people who simply don't have the technology or the technical capability to use them. So roughly half of people over age 65 don't have a smartphone. Roughly 30% of people who make less than $30,000 don't have a smartphone. Neither of these statistics accounts for, let's say, older models of smartphones that may have trouble running some of these tools. So even in a best case scenario, you're talking about the reality, which is large numbers of people and large numbers of our most high risk communities are likely going to be left out of this solution. So before we move forward with the technology, I think what we have to have is a plan for how alternative health resources are going to be targeted at these particular communities. So that could be things like manual contact tracing. It could be things like widespread testing. It could be sort of expanded health access. But a worry that I have is that states and localities who are already resource strapped are looking at this tool and thinking, well, this is a silver bullet. This is going to be our contact tracing program. And that's just incorrect. At best, it can only be one tiny part of a much larger program. And that much larger program needs to be clear to the public. And we need to understand how this will sort of fit into that larger picture. The third, issue that I think, is very important when Apple and Google is voluntariness. Apple and Google have emphasized that they expect these sort of apps to be 100% voluntary. That is a good position for the companies to take, but we need to have more protections in place to make sure that there aren't coercive efforts to force people to download these tools. There's a lot of actors, employers, people who own public accommodations, landlords who can condition, essential services on download or use of a particular tool. And so that's a bad proposition, both from a privacy standpoint, but also from a public health standpoint. Public trust and voluntary engagement, we've heard from public health professionals, is the most effective way of getting compliance, and especially when it comes to contact tracing is essential. Even if the tool has some efficacy, it's going to have blind spots. It's not going to detect when, for example, someone's, let's say, wearing protective gear. It's not going to detect when you might be in a car, and that's less likely to transmit COVID-19. It's not going to detect when you maybe don't have your phone on you, right? And so we're going to want individuals to be voluntarily engaging with the tools and the apps. And if we have sort of employers and other actors pressuring people to use these tools, what we risk from a public health standpoint is really this all backfiring, people not having faith in the systems, people not wanting to participate, and overall harming the larger public health efforts. And so before, a public health agency is thinking about moving forward with this, part of what they need to think through is guidance around, instructing employers and other actors that these tools should not be made mandatory. And also, frankly, developing avenues where they can hear complaints and take enforcement action in cases where people are being coercive, and being particularly coercive in ways that have secondary effects that result in people being denied essential services. So, for example, you could imagine a person who didn't have a smartphone, if having this type of app was a condition of going to a grocery store or a pharmacy, that would obviously have a very significant impact on their life. And so we don't want to sort of compound existing problems by adding this additional layer without the right protections in place. Next, the fourth issue I think we have to tackle is how is any information that's collected from these devices going to be used? Susan outlines, Bluetooth contact tracing, and one of the benefits being sort of that it collects relatively small amounts of information compared to, let's say, a program where we were constantly collecting location information of every individual. Notwithstanding that, it's still collecting some information. There's still data about potentially people who have been infected with COVID-19. And also, by virtue of the information, potentially information about associations. And so for people to feel confident that they can use these tools comfortably, there need to be, clear laws and guidance that, make clear that any data collected from a contact tracing app or an exposure notification app can only be used by public health authorities for public health purposes. That's something that, right now many public health authorities have said, but is not always reflected in, clear regulations and guidelines for particular public health agencies. If people are concerned that law enforcement or immigration enforcement may be able to gather information collected, I suspect that they will be deterred from using the app. And as we know, for any of these tools to have any level of efficacy, there needs to be, relatively large rates of adoption. For example, if 30% of people say download a contact tracing app, the estimate is that you're still going to capture about 9% of transmissions. And so fear about how data is used is a problem from a privacy and civil liberties standpoint, but it's also a problem in terms of prompting more widespread adoption of the app. The fifth issue is, the privacy controls that are built into the terms of service of a particular tool. One of the things that I think we're really facing right now and are suffering from is a lack of baseline consumer privacy legislation. And so as a result of that, the average consumer, can't really feel confident that there are, protections in place relating to the collection, retention, and use of their information, and that companies need to comply with these baseline standards, regardless of how they're operating. And so one of the things that, state and local governments should consider when they're working with developers to put together these tools is, do the terms of service reflect strong privacy standards? Do the terms of service require, for example, transparency about what's being collected? Do they put individuals in control of their information, only transmit data with their consent and with their knowledge? Do they require retention of, purging of information and deter retention of information that isn't actually necessary for the service? All of these things have to be built into the terms of service. And one of the things that we've seen in some states, which has been concerning, is in some cases, these terms of service have buried provisions that actually make it harder for individuals to seek redress in cases in which, let's say, there's a promise made by a developer or company, and that promise isn't kept. They promise to handle the data a particular way, it's actually handled a different way. So, one of the things we do want to make sure as well is that no terms of service prevent people from, say, going to court or taking other action in cases in which their privacy is impacted. And finally, I think the last thing that also has to be in place is mechanisms to ensure transparency and accountability. There are various jurisdictions that have taken action to ensure that new technology goes through a public process where impacted communities have the ability to not only see the different proposals, but weigh in on those proposals. When it comes to use of a contact tracing tool, we're going to want the opportunity for communities who have to use this tool to understand the proposal, be clear on sort of how the technology works, having independent entities who audit to make sure that the tool is actually being used as intended, the data is being handled as intended, and that all information collected and use of the tool actually ceases at the end of the pandemic. All of that is going to be necessary to make sure that these things work in tandem and aid public health efforts, as opposed to really alienating the public and decreasing overall trust. So those are 6 policy considerations that I think have to be in place, regardless and separate from the question of, are these tools that actually turn out to have efficacy and ones that can actually play a meaningful role in our overall public health response. And I'll go ahead and pass it back to Corey now.
Our next speaker will be Jameel Jaffer, and he is going to be presenting right now. I don't see him on camera. There we go.
Jameel? My fault, Corey. I had to agree to share my webcam. It was my mistake. I apologize.
That's okay. Privacy concerns are important, and making sure we consent to sharing our screens Absolutely. And our devices is always important. So with that, I'll let you continue. Thank you so much.
Wonderful, thanks, Corey. And I think there's a little bit of a lag in the beginning of the pickup on the microphone, so I'll just sort of stall for half a second while we pick up the audio. But look, I actually think there's going to be a lot more agreement between me and Susan and Neema than you might otherwise suspect if you look at our backgrounds or the stuff we've written in the past, in part because these issues, while they're sort of new-ish, are not particularly new in the larger scheme of things. But they are particularly sensitive when it comes to issues of healthcare, when it comes to issues of very detailed locational information, as Susan has pointed out, and the associational aspects that Neema points out about where one person might be relative to another, at what time of day, what time of evening, and the like. And there are huge privacy and civil liberties implications, as both Susan and Neema have laid out. And I think the first thing to say about this is that I think on the principles that Neema laid out, every one of those principles, all 6 of them are exactly right. I think the devil's obviously the details and how you carry them out and how you implement them, and whether the time it would take to implement them at the detailed level, I think that Neema would probably prefer and advocate for before we do anything or setting things out, may very well lead to a situation where we're not able to roll these contact tracing apps out for months and maybe even years, and maybe even make them completely ineffective, at least as for this particular health pandemic that we're going through. Now, that being said, it doesn't mean that we can't take certain steps. As Susan Ray laid out, some of the developers are already taking. Apple and Google, I think, are to be complimented for the work they've done and the privacy enhancing aspects of the technology that they've already built into their platforms, as Susan specifically laid out in detail. But I do think there's also something to be said for getting out there and trying some of this out and testing it, and see how it plays out, and assessing and if we need to, stepping back and reevaluating along the lines of the policy considerations that Neema laid out. In particular, I want to hit on a few of the things that Neema laid out as things we need to look at and maybe do before we act, and things that I would say there's some of it which we should do before and some which we should sort of do along the way in order to get this capability rolled out. I think the first thing I would say is, look, I think there's little disagreement amongst health professionals that a robust contact tracing capability that is enabled by some significant amount of technology will dramatically enhance our ability to get better outcomes in this pandemic. So Neema's points on access and the like are exactly spot on, and we need to make sure that public health authorities are not simply relying on contact tracing through technology as the only methodology for addressing populations, particularly for economically disadvantaged populations and other populations elderly populations who may not have access to the type of devices or the modern OS versions of devices that would support these type of contact tracing apps, including Bluetooth Low Energy, which isn't available, as Neema and Susan both mentioned, on all these devices. At the same time, setting out metrics is a good idea, but sort of trying to make that decision ahead of time about whether it's the right spend now and whether that money might be more effectively spent elsewhere, something we absolutely ought to consider. I'm the last person to say we should spend money, particularly taxpayer money, without a close examination of the costs and benefits. At the same time, right, there's a lot of stuff that we won't know about how effective these will be, how the uptake will be in the broad community, without actually rolling them out in test cases and seeing how they go and see how it works. And we're seeing some early indications on that at this time, and so I think that's important. Same point, I think, on the question about public decision making on these issues. Of course, our decision making bodies should make these decisions in public. They should be transparent about the reasons why they're making these decisions and the procedures under which we should have very clear rules about the way these things are being applied, both when it comes to terms of service and any sort of structure, whether legal or regulatory, around the use of these capabilities. At the same time, letting the perfect be the enemy of the good and spending a lot of time trying to figure out the exact right regulations and getting Congress to pass a law. We're in a scenario today where we're when it comes to our terrorist and counterintelligence surveillance, we have been down for 5 months at under pre-9/11 surveillance laws because Congress can't seem to figure out a path forward on these things. In this last week alone, we've seen Congress utterly fail at trying to reauthorize some of these provisions. And so the idea that somehow Congress is going to figure it out and pass a strong consumer privacy law, or that states will be able to figure out a way to implement strong consumer privacy protections at this time ahead of any rollout, I think will be difficult. And I think the same is true of localities as they're considering the rules and standards under which they deploy these things. And so I'm more of an advocate in this space of move fast, be very transparent, be very clear in the terms of service about what is allowed and what is not allowed, and what remedies people have and what they don't have, and then let consumers and individuals decide. I think people realize, given all the talk that we've had now in the limited time we've had around contact training and contact tracing, that their information about who they are, their health outcomes, or at least who their device is and where the device is, and Susan's pointed out how that's going to be also relatively limited, but who they are, relative to other human beings that may have similar devices and may have testing, that their health outcomes are going to be recorded and measured and evaluated, and that their position is going to be recorded and measured as a result of that. I think those are all things that the American public understands. They're not instinctively unaware of those things, and if they choose in a voluntary scenario to get the contact training app, to download it and implement it, well, then they've made a choice. And all we need to do, I think, in that respect, is make sure we're evaluating it well, that we're being very transparent about the way in which we're doing these things, what uses these will be used for. I think that Neema rightly says that these things, because of the huge privacy implications that apply in this particular context and the limited purposes for which people might be willing to give up their own personal privacy in a limited way, that we should ensure these are used for very limited and specific purposes. And at the end of the day, I think this idea, though, that also we should ensure that there are no limited liability provisions, or that there are no sort of waivers of the ability to go to court. I mean, look, if that's the world in which we live, the reality is these contract changing applications are not going to roll out in localities, and states are not going to utilize them. And that is actually worse from a public health perspective. I think if you asked experts in this space, which I don't purport to be, but I think the common view is that will result in worse outcomes. And so we've got to get this technology out there. I think the people who are heavily involved with it, particularly Apple and Google, are to be complimented. And I'm not always a fan of those companies when they do things that I think are not in the nation's interest. But I think they'd be complimented for the actions they've taken in this space. And I think that, it's better here to move quickly with a very clear understanding of what the options are, but rather than to slow down and wait and try to solve all the problems and all the policy questions that I think Neema has laid out, and that Susan mentions in the context of the technology that's being laid out here too. So I want to keep this short so we can get some questions. So with that, I'll hand it back over to you, Corey.
Great. Thanks so much, Jamil. I think we're going to bring back all of the panelists. And I'm just waiting for Susan. There we go. And I'm going to get to some questions if I can pull them up. They seem to have disappeared from my screen. Okay. Here we go. So the first question I have, and I think this is applicable to all of you, can sort of give your own view of this, is we've talked about other examples. We know that there have been some real problems. Neema highlighted the Utah problem, but are there examples, particularly in other countries like Israel or South Korea, where they did do contact tracing, where some of these privacy concerns were actually addressed and where it was maybe effective, or maybe even effective without addressing the privacy concerns, and we should consider those as examples of how we might move forward here?
Nobody has been using the kind of contact tracing of Bluetooth because that technology has only just become available. Using GPS, the Israelis took a database of location that they had said originally was going to be used for terrorism investigations only, and used that without court order to do tracing. There was quite a furor and went up before the Israeli Supreme Court, and then and it was found out that it was not particularly effective for the reasons that I laid out earlier. The point is, the places that have had success, South Korea in particular, have used a combination of different types of records, and they were set up well ahead of COVID. They had had experience with SARS and MERS and didn't want to be caught not knowing what to do. You have to also realize that Korea, it's not perhaps extremely well known in the United States, but Korean housing is extremely dense. It's no accident that South Korea is so well wired. A huge percentage of the population live in apartment buildings. Even if you go to the countryside, you can pass rows of 30-story, 20-story apartment buildings. When you have people living in such close proximity and you have the threat of a pandemic, you have to set up things, and that's what they did.
Yeah, I think Singapore is, one country who has rolled out an app. It does not have, extremely high adoption rates. I think the last stat I saw was around 20%. And based on the information they've put out, they've said they've been unable to conclude whether it's effective or not. So I think bottom line, we still don't know whether this is going to be useful. And we especially don't know whether it's going to be useful given the other health challenges we've had. So for example, if people are getting a lot of notifications and they don't actually have access to fast and quick testing, overall effectiveness of this tool as part of a broader public health effort might not actually yield the same results.
So that what Neema is saying brings up the whole point that contact tracing is not a particularly effective tool in an environment that doesn't have massive testing and and real understanding of where the disease is. And so far, the U.S. has been in that situation.
Yeah, and on top of that, the other challenge of contact tracing is in order to do it, for it to be effective, it has to have huge adoption rates. And so, I think the general expertise is that it has to be above 60%. I mean, if you think about those numbers in big countries, it's very hard to achieve those. Australia just rolled out their tracing app. Singapore has gotten to about 20%. And as Susan points out, they're very densely populated. Israel was effective to that extent because they sort of mandated, without mandating, they used the capability that was already in place. But the fact of the matter is that Americans have never been willing to sort of take on the kind of civil liberties limitations and sort of security enhancing measures that Israel's been willing to take on at home. And I think it's not likely, even in the context of a pandemic, that the American public is going to be up for that level of scrutiny of their activity. And so the question becomes, how do you do this effectively, and can it be effective given the numbers you need to make it effective? And I think that's one of the challenges here. But I don't think we can answer the question, will it be effective without actually doing it, right? And so without rolling it out, trying it, seeing how effective we can get to, including in this country, I think that sort of the wait and see and figure out whether it's going to be effective approach is a recipe for just not doing it at all. And that to me strikes me as a bad likely healthcare outcome in both the immediate and long run.
Yeah, I mean, I think that, just to sort of chime in, I don't think that anybody is saying, well, we have to do 5 years of studies before we roll it out. I think there is a recognition that there's obviously a moment and a need to address health challenges. But I think that rolling forward and spending a lot of money without a sense of effectiveness, without a plan for how you're even going to measure effectiveness, and without much smaller scale analysis and understanding of even the technology itself, frankly, right? This idea that you could just end up with a bunch of false positives and negatives, and who knows, that might be 80% of your notifications or 50% of your notifications, and that might actually overwhelm your existing health system because we still don't have sufficient testing in a lot of communities. So what I worry is that there's a lot of reliance on these types of tools. We don't fully understand effectiveness. And we divert health resources away from other avenues that do have effectiveness and have proven effectiveness. So I do think just a much more measured approach. I've heard people say, well, this is going to save lives. That's a great thought. We don't know that yet. And so we can't rely on that.
And one thing that concerns me is with the false positives, does that then cause people to not trust the old system of people contact tracers, and we end up in a much worse situation?
Somebody asked a question about if we typically have enhanced privacy protections for children. And so if schools are becoming a breeding ground for certainly an asymptomatic, people who are asymptomatic but may be infected, and the school systems start reopening, will that affect some of the effectiveness that you all are talking about in terms of contact tracing? And or are there heightened privacy protections that we need to have in place for schools in some way when we're implementing these contact tracing technologies?
I think you're really asking an epidemiological question and not a question about digital contact tracing, because I think the right answer to the question is, what kind of testing do we want of kids if we're bringing schools back, if we're putting people in large groups again? And there's a risk in testing kids. You're mentally freaking kids out if they get tested daily or once a week or whatever. They don't have the same mental models that adults do. And so, but you're really asking, what's the risk involved and how do we handle it from an epidemiological standpoint? So at least I don't feel I can answer it, but I want to say somebody else needs to be in the room aside from the three of us. But I shouldn't say that for Neema and Jamil. Maybe they feel fine and I've just undermined them, and I apologize if so.
Well, I mean, I think from the legal perspective, actually, I think the case is actually the other way, which is that as a general matter, we think that students, particularly students in public schools, have a diminished expectation of privacy in certain ways, right? You can search their lockers without a warrant. You can subject them to random drug testing for student athletes and the like. Whether that's right or wrong, that is sort of the law today. And so we might have a a enhanced sense of privacy for students' images and the like because of inappropriate uses of them. But as a general matter, when it comes to government, quote unquote, surveillance or Fourth Amendment rights of students, while the constitutional rights certainly don't stop at the schoolhouse door, as was said sort of famously in Tigre of Des Moines, they do have a limited expectation of privacy when going to school because of the importance and the requirement, frankly, to go to school. And so I think that's one of the interesting things. I do think, though, that there is a concern about, as Susan has correctly laid out, about the impact on children of over testing or testing and having false positives. And I don't think we want to discount that, particularly among economically disadvantaged populations, where this kind of a problem can sort of spread out through the community from students, that there's this concern about what's happening in the schools, and actually, encourage parents to keep their kids home from school. That's something we want to encourage either, unless that's the right health outcome. And I think that's one of the challenges. Now, when it comes to this larger question, stepping back, of false positives, look, the reality is there are going to be some false positives, right? But we've already made huge changes to the way in which we operate as a society. In 2 months, we've all come home. We've all been working from home. We've closed down businesses all across the country. The massive impact that has had, and by the way, I think, and we've done that in response to the views of public health officials saying this is what's needed and will help the public health situation. I think we should listen to those same people when it comes to contact tracing, and not sort of say, well, we need to go slow here and really do small scale testing in local communities. Look, if public health officials are saying this is the thing that we had to shut down our economy for, that will now get us back to moving society forward slowly but surely, then we ought to do that, and we ought to listen, as we've been telling the president and everyone else down, hey, listen to public health officials. Same thing here. Yes, there are very real privacy concerns. Yes, there are very real civil liberties concerns. But if public health officials are saying this is what's needed, we should do it.
But what they're saying.
Yeah, I mean, sorry. Go ahead, Susan.
Go ahead. Okay.
We might have been the same thing. I mean, I think that there's a couple of things packed in what Jamil said. I mean, first, when it comes to students, as he himself acknowledged, their students have Fourth Amendment rights. I would certainly be concerned both from a public health standpoint and from a privacy standpoint if there was this notion that we could, force children to get tested without the consent of their parents. I haven't seen any public health officials say that is necessary or needed or the path we should go down. I think the general feeling is that people generally don't want to get sick. They don't want to infect other individuals, and they'll take responsible steps. I think that, similarly with regards to other individuals, I mean, you sort of said, well, look, we're all sort of living in a new world. That's true for some segments of the population. Other segments of the population obviously have had to sort of continue going to work. People who work in grocery stores, many low-income individuals who don't have jobs that were easily transitioned online. And the reality is even for those individuals, most people don't want to get sick. They don't want to infect other people, but the ability to quarantine is going to be reliant on other health resources, right? This idea that if I'm sick or if I get a notification, I can get 2 weeks paid if I have to stay home, right? And so this idea that the app is not going to solve that problem. All it's going to do is highlight the need for a resolution to that problem, particularly if we're in a place where there are a large number of false positives. So you have a large number of false positives. You have people who, rely on going to work. It's going to be hard for those people to stay home and say, look, maybe there's only a 20% chance I'm infected, but I'm going to stay home, even though it means I won't have, the money to feed my family that month.
And I'd like to add, while I've heard public health officials say contact tracing, I have not heard them say digital contact tracing. What I've heard them say is digital contact tracing fitting within the workflow of contact tracers.
So that actually raises a question for me, and I think there are some other, similar to what some of the questions have been raised by the audience, is we're seeing different proposals throughout the country. We have state officials proposing things, we have local communities proposing things. To what extent should we who care about these issues and have now heard about these issues and are now educated on these issues be focusing our attention to policies set by the states, policies set by our local officials? Is there a real concern that we should all have that there will never be any effective use of contact tracing because there's not going to be a universal contact tracing proposal or a system set out? So it's sort of a several multi-layer question there, but I'm wondering if you can address some of those concerns in terms of the different ways that contact tracing is going to be implemented?
So right now, there isn't kind of, as far as I'm aware, a national contact tracing plan, right? And a national contact tracing plan where maybe a tool is, one piece or one facet of that. There's a lack of a national plan on a range of things that frankly we need to combat the pandemic. So realistically, we're at a place where most of these decisions are happening at a state level, in some cases even a local level. So, in terms of the fragmentation, I would say that when it comes to the digital tools, the state and local public health agencies actually have a lot of power. And what we have to, I think, make sure is that to the extent they're considering these tools, they're considering the right ones, right? Bluetooth contact tracing is one model. From my perspective of the models I've seen, it's the one that seems most likely to have efficacy if either of them work. But there are other people that have talked about, massive GPS collection, using cell site location information. That's not going to work. Think about when you use Google Maps and how often it tells you you're on the wrong corner. It's probably not going to be accurate enough to tell you if you're within 6 feet of somebody. And so I think we need, first step is making sure if officials are considering it, they're actually considering the right technology and not things that have sort of been packaged nicely. And then second, when it comes to kind of the privacy baseline, some of that I think will be sorted out at a state and local level. In the ideal world, we would have federal standards that were the floor and left flexibility for states to sort of build on that. There have been some federal proposals put out there, but there hasn't been something that has advanced in earnest on this issue.
Yeah, and
the only thing I would add.
Sorry, Susan, go ahead, please.
The only thing I would add to what Neema said is what I said earlier. Let the epidemiologists talk to you about what's effective. Listen to the epidemiologists and listen to the contact tracers. Now, the contact tracers all have different experiences. They've been working in the past largely with diseases that spread very differently, mostly sexually transmitted diseases and HIV/AIDS, as opposed to COVID, which transmits in a very different and very fast way. So their expertise is partial, but still they know more about this problem. It's not political, the politicians can make decisions based on politics, but first we have to have the facts out there, and it's the epidemiologists, the contact tracers are the people with the facts.
Yeah, I agree 100% with Susan on that point. There's no question that we should be listening to the expertise, and Neema's exactly right that we have utterly failed at the federal level to have an effective response to this disease. Leadership begins at the top, and it's been a complete, catastrophe. You don't have to watch CNN every night to watch the regular press conferences to see what a train wreck it's been, and how little facts we're relying on and how much sort of just gut instinct we're relying on in this way. That's a really troubling part of the response that we've seen thus far. I think there's another reason why this will be largely at the state and local level, and it goes back to this sort of old saw about how you're more likely to have a car accident in your neighborhood than you are anywhere else. It's not because your neighborhood's any less safe; it's because you spend most of your time there. And particularly with most people, and I take Neema's point correctly that there are a lot of folks who have to go to work. A lot of people in my family have small businesses or working in jobs where they don't have the option, but they have to go to work. And so I totally get that point. That's exactly right. That does tend to be sort of a regressive in terms of economic situations for folks, in terms of having to go to a work and not having sort of a job where you can just do it from your computer. But look, at the end of the day, people are spending a lot more time in their immediate surroundings, whether it's their workplace or their home. And so a lot of these things are going to be localized as less people are getting on flights and the like. And so to the extent that there's robust contact tracing in a given jurisdiction, whether it's a locality or a state, I do think there can be, and again, we should look to the epidemiologists, but my instinct and my sense of this, again, I just said we shouldn't rely on instinct. My sense of this is that will actually work effectively in that region as long as people aren't traveling as much as they have been in the past. And so, look, I think these are hard questions. We're going to see how this plays out here in the near term, but I think that I think that Neema's right, that waiting for sort of a federal law on this or federal regulations, I actually think you could probably get worse outcomes if you rely on the White House to try and figure out how to make this thing work. So I'm actually much more comfortable relying on state governors at this point, localities, than I am on decisions being made in the executive branch on these issues. So, for better or for worse, I'm not at the point where I'm at all comfortable with the plan at the federal level. So, and I'm living here in the DC metro areas, as I know Neema is. So, it's not being particularly well handled out of DC. So I'm all about getting this out to the states, let them figure it out. And then look, if we need to fix it, right? There's obviously things that the federal government can do and condition funding on to get better outcomes if we need to do that.
Great. Well, we are almost out of time, but I want to leave with each of you answering one quick question in a minute or so, in terms of, we've got 150, 200 people here, and this has been extremely informative. But I also want to know, if you were to advise all of us, what is one thing we can do to make sure that at least for each of us, what we view as the appropriate balance between civil liberties and public health are, what can we do to advocate for those types of policies? Do either of you want to, who wants to start first? I'll let Neema start.
I would engage your state and local public health agencies. I think the two major issues to raise with them are the equity ones, which I think, frankly, we're struggling with in a lot of places. And a lot of the deaths we've seen have been in particular communities, and the experiences of countries overseas have shown that if you don't actually address disease spread across the board, you have resurgences. In Singapore, one of the resurgences was in migrant communities where they lived in poor living conditions, for example, where they were social distancing was difficult. So I think talking to your public health agencies about the equity issues and really pressing them to be fully transparent as they're considering these solutions. And then I guess the third thing I would say is invest in manual contact tracing. These tools, they may work, they may not work, but in any case, we're going to need a whole lot of manual contact tracers.
I would say that manual contact tracing is critical. It can be supported by these tools, but we need to really focus on the equity issue. Because if we don't focus on the equity issue, as Neema said, it's not going to work. The people who are affected, the people who have been most affected by this disease, are not going to trust contact tracers, government officials, health officials, unless they see they're being treated fairly and with kindness and decency. And so it's absolutely critical that we get the equity issue right.
I agree that equity is important. I think the key issue, though, for the average American is going to be transparency, and demanding transparency both in the process but also in the apps, how the data is being used, understanding that, making it very clear, simple language that everybody can understand, and be very clear what you're signing up for, what you're not, so we can get people comfortable with signing up to do this and do it. I think that rather than being a supporting to the manual contact tracing, I actually think that this has got to be the primary method, because at the end of the day, the reality is we cannot hire enough manual contact tracers. We cannot deploy them widely enough to really make that effective on a disease that happens at this scale and at this speed. That's the fundamental difference between this and prior situations that we've faced, at least not since 1918. And so at the end of the day, if we're going to succeed against this virus, and it does recur, right, or the next virus, whether it's this one or the next one is really sort of, I think, immaterial, we're going to have to rely on some amount of technology, a significant amount of technology. And so the transparency issues are key. And I agree that we have to address these. This just highlights the equity problems that we've long had in our society that we've largely tried to ignore and avoid. And this hopefully brings those to light and really makes us focus in on those. But in the immediate term, transparency from the way we're doing these things and what these apps collect, what they don't collect, how they're being utilized, and make sure that we're all comfortable with those as we move out on these things.
Well, thank you all so very much. I know I've learned a lot and will be able to use this in my daily work. And I think, and I'm sure everybody who is here attending and listening in is getting a lot of information. So thank you all so much. And thank you to JCPA. Please continue to support JCPA. We have a wonderful webinar series on all sorts of topics: criminal justice reform, voting rights, and food issues and safety net issues in the face of the pandemic. And I encourage you all to check them out. And again, thank you so much for attending. And the three of you, thank you so much for sharing your expertise with all of us. Thank you again.